Cases among the young and old in Sierra Leone. A more deadly virus, hepatitis, takes center stage, drawing the attention of medics to the needs for more tests and treatment. On Bottom Line this Tuesday, host Joseph Egbenda Kapua engages medical expert on hepatitis, Dr. Musa Sahid Conte, on the cause, the effect and treatment of liver enlargement from virus or toxin. It's Bottom Line this Tuesday at 7 p.m. on SLBC.
Hello and welcome to Bottom Line, your enlightenment campaign talk show. My name is Joseph Egbenda Kapua, and tonight we shall be looking at the enlargement of the liver or hepatitis, which reports suggest is very critical on the move in Sierra Leone. Dr. Musa Sahid Conte is a medical expert on hepatitis in Sierra Leone. He is my guest tonight, who will be telling me more about the outbreak of this virus and how it has been handled in Sierra Leone. Welcome to Bottom Line, Doc.
Good evening.
You can also be part of the program by joining us live on Facebook at SLBC TV channel 31 and YouTube, or by sending your text messages to 030-022-639, 030-022-639. The program is Bottom Line. Now let's get started. Dr. Conte, it's breaking in Sierra Leone. A good number of people are not aware about the program, especially when it comes to hepatitis. They are not aware. A good number of them are so aware about the virus itself, but it's taking ages, and people are yet to understand what hepatitis itself is all about. What is it? What is hepatitis? Maybe you want to give a brief history of the disease.
Thank you very much. Good evening, listeners out there. Thank you. And to start with, it is for a layman point of view, it is infection that involved the liver cells that we called hepatocyte. All right, these cells get inflamed, means swelled, and that they caused what we call hepatitis. Okay, and that when we say inflammation, means that we have the cells having swelled, present with pain and redness, warmed, which you can see with many examinations we do. But this is a broad problem. It is in this country as we speak. Because of lack of knowledge, people don't know about it very much, and that some of them know but they ignore it. So it becomes a very burden disease in the country as we speak, and that it is a disease that is almost in presentation clinically with malaria and typhoid. So people misunderstood it for malaria and typhoid most of the time. And that is, this disease, as it is common among the young population. So that is why we are very much worried when we talk about hepatitis.
When was it discovered in Sierra Leone?
Well, actually, there is no a particular literature talking about how it's discovered. But what I know is that it has been there for a long time. It's only that it is not, people don't focus on it because of lack of knowledge, as I said earlier. People don't focus actually, but it's there. It has been there for a long time, just like we have HIV and other infectious diseases. It is there. But I want to say that it is disease that is on the increase
in Sierra Leone.
In Sierra Leone, both in the new cases, that is the incidence and the prevalence, due to so many risk factors among youth, among the population at large. So people don't pay attention on it, and that it is in the increase. Though as we speak, there is no any formal CSOC data showing the increase, prevalence, and the incidence of it, but it is on the increase as in a clinical point of view.
What causes hepatitis?
All right, there are so many causes, which according to many authorities have their ways of the classifications of the causes. Some authorities put them causes of viruses, some said causes known viruses, and other drugs can cause them. From the non-viral causes, we have causes like toxoplasma, leptospirosis. These are all fungi, bacteria, they can cause this disease. Okay, and we have other causes like drugs, paracetamol, and the other drugs like paracetamol can cause it, and many other drugs we use.
How does paracetamol cause it?
Well, when you have an excess ingestion of paracetamol, overdose, it can cause inflammation of the cells, which we call hepatitis as well. So it can happen. Even alcohol, is a drug that can also cause it. Excess intake of alcohol can also cause it. All right. We also have some cases, but it's not common, among people, young girls taking contraceptive. It can also occur. All right. We have very many causes which are not infectious that can cause it. All right. You have even circulatory failures, pregnancies, other causes that can lead to it. We have inherited diseases that can also cause it. Wilson disease, for example, can cause it. Then we come specifically to those that we know, which is common even among the clinicians, that can cause this, which are the viral type. And among these variants, we have the major causes, viral causes, we have minor viral causes. And the major viral causes, you have hepatitis A, B, C, D, and E.
Yes, now take me through those.
Right.
The different types. You're talking about hepatitis A, and B, or C.
And hepatitis A, they given the name based on the way they infect the liver. Hepatitis A, as we speak, it is caused by things we eat and drink. And the medical people will tell you it's fecal-oral, from your mouth and from feces transmission. So happens. And this one happen more with children, young people. Okay? Children are the major causes, major risks group. Okay? And people, we also have it through other means. Adults as well can have it, and it is very much contagious as it is, especially in people living in poor hygiene places, overcrowding. And this is the one that I'm really I'm saying that it is the one that people most of the time misunderstand with malaria and typhoid. Okay, why people have this, present with this disease, because it has the same presentation like malaria and typhoid in the clinical pattern. So people misunderstand it. And the second one is hepatitis B. That is the most contagious. One means that's the most infectious and most deadly one. All right?
Hepatitis B.
B. And it is the one that is on the increase as we speak in Sierra Leone. All right? And we also have hepatitis C. It is also very much contagious because it causes chronic liver problems. All right, and it also can have it through blood products, and through other many causes that use blood to do, even health workers, people using intravenous drugs, using this injection to inject themselves with drugs, see cocaine and other thing which is not common. Tramadol. You have it, people with tattoos. Yes, this making with these tattoos their skins. You have it with people, and even prostitute, sexual workers. You have it also amongst promiscuous men and women, especially when a man or woman has more than 5 sexual partners in 1 year.
Does it have to be more than 5? It could be more than 1.
Yes, but what is the risk increases as you have as many sexual partners you have, as the increase in rates. So you also have it even among you have it among people, family members who are very close to people who are infected, because they might not know about it. Okay, because it is, as I said, highly contagious. It can be transmitted through the blood and the product of blood. Some authority, which I'm not sure, want to say that it's also close contact with people. The sweats, you can also contact, especially when the person is in active disease. And this hepatitis B also has very many patterns it presents. All right. But I just want to tell people that what is happening here in the disease pattern is that the disease can be acute or chronic, like any other disease. When it comes in the earlier time, very short time, just sudden, spontaneously, within, according to the classification, less than 6 months, or within some weeks, it's called an acute hepatitis. When it happens more than 6 months, taken for a long time, gradually it comes. It's become a chronic disease. Hepatitis has many patterns. You can have the disease as an acute disease, wherein especially with hepatitis A or C.
Oh, there's an C.
Yes, you have C. I'm talking about C now.
So we have A, B, and there's also
D and
hepatitis
E.
C.
They are D. Many of them has, like hepatitis D. They said it does not exist on its own. Hepatitis D is common among patients with hepatitis B. When you have hepatitis B, you have high risk of having hepatitis D, because they said hepatitis D is an incomplete virus. It has to, it's a DNA virus which needs to code, which needs to harbor itself among hepatitis B to sustain its life, to complete its genome. So it's always almost co-infection with hepatitis B. So most people with hepatitis B, as you diagnose, they treat you, they give you prophylaxis or vaccine against hepatitis D, because these people have high chances. As I told you, the risks are too many for hepatitis, among especially the virus, the blood transmitted hepatitis, because hepatitis B and hepatitis C, these are major blood transmitted hepatitis. You can get it mostly in blood and blood products, wherein transfusion, multiple transfusion in people that have hemophilia, a bleeding disorder, wherein they continuously bleed, so they need to be replaced with blood. So they have this hepatitis B and C. They have the high risk. People, as I told you, with tattoos, health workers, because we use needles to do our procedures, we can prick ourselves along the way and get infected. All right, we have even people with kidney disease, because kidney disease, they go for, especially when they are in the terminal stages, and that we need to resuscitate, revitalize, and help the kidney. They do some procedure called dialysis to do the function of the kidney. That is an artificial kidney. These people, they got this dialysis process, means you clear off the blood, you wash out, just like kidney functions. So in that process, you can get infected.
You also told me about those who take too much alcohol. Talk to me about that.
Yes, alcohol, you know, alcohol metabolize won't mean that it passes through the liver, all right? And the liver process it for us to have it in different performance it causes in the body. So if somebody is taking too much of it, it will suppress the liver gradually, decreasing its functions. As I told you, let me tell you this, the liver is one of the major organs of our body. It has too many functions. Among it is metabolic functions, wherein it has to break down proteins, carbohydrates, and lipids for us to use it appropriately in different physiological processes in our body. We also have, the liver also have its function called making up proteins. And our body depends on proteins to survive. Many of the reactions in the body, which is keeping us alive, it depends on proteins. So the liver is a reservoir to make this kind of proteins, like albumin, proteins that keep our body, that maintain or prevent bleeding from us, which we call the coagulation factors, proteins that prevent us, that increase our immune system.
When you spoke of too much intake of alcohol, what do you mean? Is it like at any given time, or consuming it almost on a daily basis? You know, what is too much?
As you and I know, when we say too much intake, we mean that, you see, certain people can take more than 5 pints, or you call it, as we commonly say, of alcohol, and in terms of the intake, in terms of the concentration of the alcohol, that would mean excess. Some of them take too much rapidly. You have people who can take more than a crate. That is excess. Some people will not take too much.
So that's like a dead man walking.
Yes, they take high concentration. High concentration, like we have these Indian people, other people making this local hard liquid.
Like the Punjab in Kenema.
Yes. And this other Shankaras, they have this high concentrated alcohol, which when somebody ingests this one, will pass through the liver. You know what it causes? People who will explain to you that it is very high in concentration, which will, when you ingest it, you have to feel burning sensation going down. And this burning sensation will go to the cells of the liver, cause the inflammatory process that will cause hepatitis.
You also spoke of, I think this is also common among our younger folks, if you like, those having the tattoos and, you know, who map their bodies and what have you.
Yes.
How dangerous is that as well?
You know, yes, very dangerous. You know, like people are in the social norm to have too many tattoos around the body, and because some of them love that, and some of them do that for other reasons. So in that process, you know, these people who are doing it are not medics, and they don't take precautions in their actions. They are not doing it within controlled, sterilized processes. So they use the same needle, for example, to prick somebody and do it to another person. So you might not know who you're doing it with, and the relation of the different people. So you can have somebody positive going for a tattoo, and somebody do the tattooing process, and another person comes, you do it at the same time. So you have crossed the infection to another person during your process. So this is.
Is it also applicable, you know, to barbers, those who go to, yes, you know, cut the hair?
It is applicable. as I said, blood and anything that has to do with blood, spilling, injuries that will lead to spilling of the blood will lead to the transmission, especially when you do it with somebody that is infected. Sterilization is not too proper in some barbing places. So when you do it, you have done it to somebody positive, another person who comes that is not positive or negative, don't have the infection. You do the same, you barb, and on the process you got the person in.
No, Doc, I haven't explained the different types of hepatitis. Talking about A, hepatitis B, C, D. Which one is more common in Sierra Leone and why?
Hepatitis. Well, to say that there is a authorized literature or information telling us which is more common, because as I speak, I don't know of any research that has been done in Sierra Leone to tell us the most common hepatitis.
Oh, okay.
So we cannot really tell which one is more common amongst the population. But what we see commonly is hepatitis B, mostly. But there can be other ones, A, B, C, E, and D. Okay? So this is common there. So if I can tell you this, I am not in the authority to say that this is the one that is common here. Or
let's talk about the symptoms. We now already know the causes of hepatitis, and like, what are the symptoms? You spoke of, semblance of malaria.
Yes. The symptoms have just like malaria.
Only malaria?
I'm just saying, just like malaria, the symptoms are just very similar. In that you can have fever, as normally happens with malaria. You can have headache. You can have body pains, muscle pains. You can have vomiting. All right? Yes. Or sometimes having the feeling like you want to vomit, which we call nausea. And you can have lost weight, wasting. All right? And people who have even constipation do stool. All right, these are the early symptoms you see, and as the disease goes gradual, as I said it earlier, that the disease, we have the acute stage and we have the chronic stage. As I said, hepatitis B and hepatitis C most time have high risk of getting to the chronic stage, which is the chronic liver problems. Okay? Hepatitis A and B, you can have it sometimes. You can get returns. You stop in the acute stage and returns to normal. All right? But not obviously at all times. There are certain percentages which is other countries are telling us that in certain people, among certain 15 to say 20% of people who are infected will get the acute stage and go to normal, and about 80% of them will go to chronic liver disease problems. So you see, this is how the disease patterns work. So as I say, the clinical features, you have the acute ones that I just said, similar to malaria. You have, but when you got chronic now, you start to see jaundice, yellowish of the eyes, which you call icterus. You start to see progressive wasting of the body, loss of appetite, loss of sleep. Okay, the patient will not sleep at all, wasting, and you start seeing the patient is pale. That is the clinical signs you will see now. Okay. And that it is when it got progressively that you start to see the liver got enlarged, which you just said is enlargement of the liver, okay, in the progressive stage. So you see many of this problem. As I tell you, the problem gets gradually and increases, affecting many other systems.
Is it curable?
Well, if it's early, if you detect it early, and that you detect it early and early treatment is some extent you can treat it. But especially certain hepatitis, among the 5 variants that I've said here, B, C, for example, and most of the time they hardly cured. Okay, most of the time, because people will harbor it and then be on the marks which we call the carrier state. People might not know, continue to treat malaria, continue to treat typhoid. They have it, do not test, and as discovered later on now, it has got to the worst problem. So there is, in that case now, it is very hard for us to treat that one.
Is the vaccine readily available in Sierra Leone?
Yes, there are a couple of places that they have the vaccine, right? And as it is, these places, although it's not very much available, or it is very expensive, all right?
Very expensive?
In the sense that a common man cannot get it as easily, except for certain levels, because I understand it's about 200 to 50,000 per shot, and you have to take like 2 to 3 ones. So it's expensive to some extent. So it is available, but not too affordable, I want to say. All right, and that you have to go some, and that you don't only. I just want to caution us that vaccine, we don't rush in giving vaccines for hepatitis. If you want to do it on prevention basis, you have to test. You have to do a test that confirms that you are negative, because it is not advisable to take it when you are positive, because it will cause more problems than you think.
Now you just said it. Is it preventable?
It is, yes. All particularly infectious diseases as well as non-infectious problems. Yes, when you know the risk factors that cause it, you will use the precaution to prevent it. Especially
E.g., you stop drinking alcohol?
Yes, you reduce drinking, than one. Yes. You take precaution of, like health workers, you have to take precautions of hygienes and IPC, infection prevention control protocols, wearing gloves, all right, etc. If you
stop the tattoos.
Stop tattoos, reduce having too much of sexual partners, reduce, and you take prophylaxis in case of people having to go through dialysis, in case of people having hemophilia, which is congenital, right? And having people use, and you talk about people who are, if you taking too much alcohol, you reduce. And if you suspect that one from somebody, your relative, you have to take precautions of either having a vaccine, all right, and or you have to prevent very much close contact. We are not saying that you have to isolate yourself from a relative, but you have to just conscious about it.
Like the vaccine, prevention sounds expensive. Not so?
Yes. And yes, that's true. But the best prevention you can do is knowledge about this problem. And if you have the knowledge, you know the different ways in which this problem can be transmitted, and you prepare and you take the precautions. Like I said, if you know that you can have it through sexual intercourse, you have to
reduce the number of partners.
All right? You have it through and multiple transfusion, through tattoos, all right? Through even in going to
haircut.
Public haircut, all right? You have. I'm not saying you should not go there, but you have to find a way you will do precautions. That even sometimes people use brush, they exchange toothbrush. That's another way of transmission. All right. So many things, and you have to know the problem before you find the prevention appropriately. And knowing the problem means that you know the risk that involve, the risk that will cause it. As I tell you, especially young people with the university, what have you, are fond of going out, taking too much of risk. Tattoos, IV drug use is a problem. Body is a problem now among the population. All right, and we have to control that and prevent that.
All right, the program is Bottom Line. If you are just joining us, you're watching Bottom Line, and I'm talking to the medical expert on hepatitis, Dr. Musa Sahid Conte. You can join us live on Facebook, on SLBC TV channel 31, or you send us SMS to 033-022-639, 033-022-639. The program is Bottom Line. Now, maybe we continue to look at the aspects you are dealing with, Dr. Conte, talking about how expensive the drug is, affording it is pretty difficult, and the like. Now, talk to me about how deadly hepatitis is.
To speak, when we are in the chronic stage, hepatitis is highly deadly. By that I mean, if you have chronic hepatitis that has been with you for over 6 months, the liver, as it is, gets, first of all, first stage is inflammation. And as time goes on, it gets a stage that the cells will die, which will cause necrosis. And this stage, now you start seeing the liver enlarged, and as it progresses with accumulation, as the liver has its own function, and as I said, many of the food you take up, ingesting, pass through the liver to a first pass process, it continues to accumulate. The liver is no more doing its own normal functions. So it got, cells are dead, normal function. So it continues to infect other organs. It continues to affect other places, like the kidneys, all right? It also gets infected. So you have many of the accumulations of the substances that the liver usually breaks down. Fats, lipids, carbohydrates, proteins, they accumulate. And the functions of guiding you, protecting you from bleeding continues to have problem. So the proteins that stop bleeding, when you get acute bleeding, there are proteins that the liver will produce to control that. So if you have hepatitis, as time goes on, the bleeding time will prolong. So when you get injury, you bleed for a longer time. So you also have your defense mechanism, your protections, okay, which we call the complement factors, which aid you in fighting infections, begins to drain. So the problem will begins like you have inflammation going to necrosis, enlargement, stopping the functions. As we go on, it begins to impair on the kidneys and other organs in the body.
All right, let's look at some of the text messages coming in. This one here reads, please, I want to know of a disease associated with liver, whether they are curable, more so with a condition called, is it ascites also?
Ascites.
Ascites, for the medical practitioners will know this. Dr. Conte, recent studies have shown that health workers in Sierra Leone are mostly at risk and for the most part lack adequate knowledge on the disease, which increases the possibility of hospital-acquired infection. What do you suggest as a short-term and long-term intervention of hepatitis B? And the one here is, doctor, is it good for a patient with hepatitis A to stop eating protein and oily food? Dr. Conte, is chronic hepatitis B a serious problem among children? Maybe you want to start with this one, Recent studies have shown that health workers in Sierra Leone are mostly at risk, and for the most part they lack adequate knowledge on the disease, which increases the possibility of hospital-acquired infection. What do you suggest as a short-term and long-term intervention of hepatitis B?
Well, yes, the texter is right. Health workers are highly exposed, and I am not familiar with the study, but I know that the health workers in Sierra Leone are highly exposed to this disease, and that as a short term, as he said, we need to know, increase knowledge and awareness of the disease among ourselves. Because if you have the knowledge and you are aware of the problem, you will have consciousness to control, to take precautions. So one of the short term is knowledge increased among health workers. And that among it, the long term is infection prevention control measures among us. And that we should note that this is highly contagious, especially hepatitis B, the text I was saying. So you have to know and take adequate precautions. And as well as the long-term precautions measures is for the authorities concerned to provide, to have at least free vaccination for health workers, wherein we will, every health worker have the privilege of having a free vaccine against this virus.
Now look at this one. Is it good for a patient with hepatitis A to stop eating protein and oily food?
Yes. As one of the functions of the liver is to metabolize, to break down fat. As it is infected, that function is impaired. All right? So if somebody takes excess protein, excess fatty food, it will give more burden to the liver, and you will cause more problems with multiple problems in the blood and the other systems of the body.
Is chronic hepatitis B a serious problem among children? This text writes.
Well, and for children, the most common hepatitis is hepatitis A among children. Yes, can be a problem, but not so often as compared to adult. Hepatitis B is more often with adult, okay? And while in hepatitis A and C are mostly among children. So if I to answer that question, is to tell you that it's a disease that occurs within all ages, but it's more among adults than children.
Now, this one here is hepatitis A, hepatitis B, hepatitis C. Is it the stages of the sickness that worsen, or is it something different? The person is asking whether, for example, hepatitis A graduates to hepatitis C as the disease worsens, or are they just different altogether?
They are different altogether.
Okay.
Okay. It is not a gradation that makes you call it A, B, C. They are all different altogether.
All right. And this one here is, when one is positive but it's inactive, how can you explain that?
Yes. The person is talking about carrier state. Yes. There is a stage wherein they do a test, blood test, and you are positive, but you're not showing any sign or symptoms. That stage is what we call the carrier stage or carrier state. So in that case, they said you have to follow the patient closely. You don't need to worry about saying you have to be in worry, giving drugs, whatever. You follow the patient, giving supportive treatment, so that you see that, because as I said, there are times wherein somebody gets infected and returns to normal. Okay? Right. Like in the hepatitis A, when somebody has hepatitis A, for example, you have some stages, or you have other hepatitis not with infectious cause. Because as I said, hepatitis is not only from viruses.
Okay.
Yes, it's not only from viruses. Drugs, okay, alcohol, non-viral causes, protozoans,
Sex.
yeah, no, sex can, no, I'm saying the cause, I'm not saying the
Okay.
risk. You are talking about the risk, I'm talking about the cause itself. Can be with virus or not, with other problem. Even your immune system can react against the cells of the liver and cause an hepatitis.
All right.
So it is many, but what we should know is that the hepatitis is not the graduation.
Okay.
Okay, it's not, the name is not gradation. And as I tell you, if you are carrier state, there are two ways to say you have an active carrier and a passive carrier. There are stages when you are a carrier, and when you do a test, you are positive, plus the liver enzyme that we call it, that the liver produces, become high. There are stages where you are positive, but the liver enzymes are normal. So this is a passive.
And let me just inject this one in. It's raised from the text. It said, I have been diagnosed with hepatitis B few weeks back. So I told my girlfriend to do the test, and she tested negative. How is that possible?
Yes, it is possible. It is very possible. Because it depends on, one, how long have you been diagnosed? So how long the disease has been with you, okay? So that you have a chance of transmission, okay? And that, as I said, the risk of having it is close contact. That's what they said.
Okay.
Okay, and you know in sex you have close contact. And there are stages you will transmit the disease, especially hepatitis B. Here where they start seeing that you have certain antigens and antibodies that you produce within stages. Like in the case wherein you have hepatitis B surface antigens, okay, which shows that there is the disease, and you have also hepatitis B core antigen, where it shows that there is multiplication of the virus in you. So in that case, you have high chances of transmission. Okay, so if saying that you have just the surface antigen and there is no time yet for you to have the continuous multiplication for you to transmit it, so there is a low risk for you to transmit it to another person, except you have direct blood transfusion from, you give blood to your girlfriend or whatever directly, which will cause the problem.
Now let's look at this again. It says, how long do the viruses that cause hepatitis survive outside the body?
Well, as you should know from a general rule that, you see, viruses, they are not cells, they are not living particles. They are proteins that they need to survive in cells before they continue their life. So that is why they come in us. So when they are outside the body, most times, especially and within certain age, so they will die. So it takes not too long time. Some different authorities have their own, and from other textbooks will tell you that it is about some hours to days, which the virus will die.
If you're just joining us, you can take part in this program by sending your text messages to 030-022-639. 030-022-639. The program is Bottom Line, and I am talking to Dr. Musa Sahid Conte, medical expert on hepatitis in Sierra Leone. Now, Doc, is there the likelihood for someone who's been vaccinated to contract the virus again?
Yes. Yes. You see, when we say vaccination, doesn't mean stopping infection. It means boosting the immune system to respond against infection.
How is that different from preventing it?
Prevention means that you stop absolute contact to it. All right? Vaccination, you improve the body response against virus. So in other cases, if you get infected, if you get vaccinated, you are just protecting yourself against the serious problem of hepatitis. Okay? And that some vaccinations will protect you for some time in your life. Some say 20 years, some 10 years. And that after those times, you are free, you're exposed to having the disease. And again, you will not say that because I have taken vaccine, so now I can go and give or take blood of an infected person. Because if you do that, you have the infection.
Or if you take too much alcohol, if you tattoo yourself again, even when you are vaccinated,
of course, you know,
there's a likelihood to
what we
contract
vaccinate, when we vaccinate is the infectious part of the disease. All right. You will not vaccinate. You will not take vaccine against excess alcohol. There is no vaccine for that. You understand? You will not take vaccine against paracetamol. There is no vaccine for that. The vaccine you take is for the infectious viral hepatitis. Hepatitis A, B, C, this is for it. But you will not just go and take the vaccine and start having, you go out there and have an excess injection of paracetamol and alcohol or other drug like dopamine, methotrexate and other things.
Now, Dr. Conte, how bad is hepatitis as compared to Ebola and maybe even HIV?
Well, if I to compare hepatitis and HIV, I would say that most often people with HIV have high risk of getting hepatitis because of the immune system. In HIV, there is immune compromisation or immune deficiency, total deficiency in some cases. So in that case, you have high chances of having hepatitis if you're exposed as compared to somebody having a normal and a competent immune system. Okay? And Ebola is a virus, you know, which is very contagious and can cause very serious bleeding disorder, which we call hemorrhagic viruses. So in hepatitis, it takes time for you to get to the stages of bleeding disorders. Okay? So if I compare the two, I would say that Ebola is of much serious problem in terms of its own disease, the clinical patterns, okay, and it's more contagious than hepatitis. All right, but as well, hepatitis is more serious and can lead to many pathologies. Like the first person saying, what is the, we are talking, when later we talk about the complications, we'll explain to them what are the too many complications hepatitis can cause. Okay, all right. So, like the complications you will see in an hepatitis patient, the patient will have what we call hepatomegaly. The liver will become enlarged. We have bleeding disorder, decrease in immune system, renal problem, anemias, bleeding. That means the patient will lose blood drastically because the liver is where we produce a hormone called erythropoietin. About 15% of it comes from the liver. So we have any problem, and you have a liver cancer. This is the terminal problems of hepatitis. You develop to liver cancer, which we call hepatocellular carcinoma.
All right. Now, Doc, if let's assume my hepatitis vaccination series gets interrupted, do I have to start all over?
There are certain of them that we said you don't need to start all over. Okay? especially if you have, like, you need to take 3 doses. You have taken 2. The textbooks are telling you that you don't need to start all over after you've taken the 2nd dose. All right? If it is interrupted, you can leave it or continue, but you have to do a test to see that you have gained immune response against what you have triggered. Because a vaccine is to, as I told you, to trigger the immune response against the virus when you have it. So it is what I would say, the body or a part of the virus that they will ingest or inject in your body, in your blood, to stimulate the antibodies that will respond to that virus.
What drugs are used to treat hepatitis?
Well, most of the time, antiviral drugs in various cases, okay? In non-viral cases, you can use other non-viral drugs, okay? In viral cases, you use antivirals like lamivudine, atenovide, okay? Adenovide and ribavirin, you use them. You can also use a protein called the alpha-fetoprotein, okay, which you use to protect, to increase immune response and stop multiplication of the virus.
Now let's go through the second set of text messages. It says, Dr. Conte, thanks for the education on hepatitis. How can one do the test? There's one question you want to take note. Can you explain more about the signs and symptoms? So my younger brother was diagnosed of hepatitis B over 15 years ago. He still complains of stomach ache. Why? On diagnostic basis, please explain tests that can detect chronic and acute hepatitis B virus. What is the name of the liver cells affected, and what is the IPC protocol for hepatitis? You mentioned that incidence and prevalence data are not together available in the country. How do we improve the surveillance and detection of hepatitis B?
Let me have them.
Serially. Okay, let's start with the first one. Can you explain? We don't have much time, I'm afraid. But in this one, can you explain more about the science? I think we've exhausted this. But my younger brother was diagnosed of hepatitis B over 15 years ago, and he still complains of stomach ache. Why?
You know, it has been over 15 years ago, which is diagnosed. As I told you, it can be in the carrier stage, where maybe the younger brother is not showing any signs and symptoms for now. But as time goes on, if he's lucky, it will come to normal or go to the serious.
I think we have to watch
abdominal pain,
this, yes.
Abdominal pain can mean anything, not only hepatitis. So the person should go to the hospital and they have further.
On diagnostic basis, please explain tests that can detect chronic and acute hepatitis
test
B
you do
virus.
to detect a chronic and an acute, you do what we call serology, blood test. The blood test will tell you, one, the presence of the type of hepatitis you have, A, B, C, or D, whatever, and then you do other tests like the bleeding time. You test to see if there is any bleeding problem that have gone, so that you know that it has gone to the worst condition. You also do a liver function test, because you know the liver is involved and you want to know if the function of the liver.
How is the test done, Doc?
You do blood. I said serology. Collect blood and you do test in laboratory. They are looking for certain things that will tell you that the liver function is being impaired, especially when they say the alanine transaminase and the other enzymes you look for. And you look for the liver, the substances the liver produce. So this is what they look for in the test. And if these substances are high or they're low, telling you that if they're low, telling you that this is a problem with the production problem. And if it's also high, telling you that they're excess production. So we have particular one like the ALT, which is the key enzyme we look for. and the type of virus. And the liver function itself is a major test we rely on to tell us what stage the problem has been. Okay? If somebody, we look at ratios of ALT, AST, that's, maybe I'll just say something, but these enzymes tells us this is a stage of a serious acute, this is a chronic problem.
I'm afraid let's stop it there. That's all what we have time for. Thank you very much, Dr. Conte. The program has been Bottom Line, coming to you from the SLBC television and also from our Facebook page, SLBC TV channel 31. I'm afraid we have so many text messages coming in, but we can't afford reading all of them because of the time. But then if you missed this program, I think there will be a repeat broadcast. We'll tell you the time that will be, but then you can also join us next Tuesday for a fresh edition of the program, Bottom Line. It has been hepatitis, causes and effects of hepatitis. They call it is the enlargement of the liver. How is that prevented? How can it be prevented? What are the complications? The doctor has been here talking to us about all of this, and we hope this has been a lesson to all of us watching this program. We hope we'll have another opportunity to talk to Dr. Conte on this much, well, I will say, topic that has generated so much text messages from our viewers and our listeners from across the world. Many thanks to my producer, Tilly Koma, who has been up and down ensuring that this program runs the way it has come out, and also to all members of the technical team. Joseph Ibuna Kapua is the name. Goodbye.
TV channel 31 and on YouTube. Be a part. As HIV rate increases among the young and old in Sierra Leone, a more deadly virus, hepatitis, takes center stage, drawing the attention of medics to the needs for more tests and treatment. On Bottom Line this Tuesday, host Joseph Egbenda Kapua engages medical expert on hepatitis, Dr. Musa Sahid Conte, on the cause, the effect and treatment of liver enlargement from virus or toxin. It's Bottom Line this Tuesday at 7 p.m. on SLBC, the official voice of the people of Sierra Leone. You can also follow the discourse live on Facebook at SLBC TV channel 31 and on YouTube. Be a part.